New York State's new plan to combat COVID-19 during the winter season focuses on 5 main points that will strengthen the state's microcluster crackdown and help hospitals deal with a surge in activity. Governor Andrew Cuomo announced the strategy yesterday. He says that with more than 3,500 people now hospitalized statewide for COVID and more cases are expected in the coming weeks, hospitals must draw up plans to redistribute patients both within their healthcare networks and between networks so that no one hospital becomes overwhelmed, as happened when the pandemic first started in the spring. Well, the figure is up from 900 people hospitalized in late June, Cuomo says, and cases will only rise as New Yorkers gather to celebrate the holidays.
In the new battlefield, hospital capacity is the top concern, period. It's about hospital beds, it's about ICU, and it's about having enough staff and enough equipment. That is the effect, and that's what we're going to have to deal with.
Now, much of the focus over the past several months has been on containing the virus through restrictions at bars, restaurants, and other businesses, but Cuomo says data from contact tracing shows that 65% of infections are now coming from small gatherings. He says New Yorkers should be responsible and not host gatherings over the holiday, since law enforcement can't monitor everyone's home. Depending on how bad the situation in New York State gets, the governor also says it's possible that we could return to New York on pause, where non-essential businesses are shut down. A full rundown of the plan posted right now at WNYNewsNow.com and on our mobile app.